Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Hand cramps. What's causing them? Hand cramps can occur for many reasons and can cause significant pain and problems for some people. Hand cramps commonly result from an injury or health conditions. /r/n/r/n cramping in the hands might also affect the fingers. Hand and finger cramping can limit your ability to do certain activities, including writing and driving. /r/n/r/n hand cramps can be treated and prevented depending on the cause. While rare, hand cramps can sometimes be a sign of a more severe condition, like rheumatoid arthritis, RA, or diabetes. /r/n/r/n This article will cover the causes of hand cramps, symptoms, self-care, treatments, and more. /r/n/r/nJacob Wackerhausen Getty Imagesrnrn Hand cramps can affect the entire hand, part of the hand, the palm, the wrist, or the finger joints. Cramping pain can occur when writing, typing, driving, holding and gripping objects, and doing household chores. /r/n/r/n hand cramps have been linked to a number of conditions, some more serious than others. /r/n/r/n Sodium, potassium, and calcium are types of electrolytes, substances responsible for maintaining normal body functions, including nerve and muscle activity. The muscles require optimal electrolyte levels for the body to function properly. /r/n/r/n Alterations in electrolyte levels can affect how the muscles contract and relax, leading to cramps in your hands and fingers. /r/n/r/n Magnesium plays a vital role in controlling muscle contractions. If your body's magnesium levels are low, you can experience muscle cramps throughout the body, including in the hands. /r/n/r/n Additional symptoms of a magnesium deficiency may include /r/n/r/n You can reduce your risk of magnesium deficiency by adding more magnesium to your diet. /r/n/r/n Foods that are high in magnesium include /r/n/r/n Dehydration is a state in which fluid levels drop to the point at which body functions are affected. Mild dehydration can be remedied by drinking water or electrolyte drinks. Severe dehydration can be life-threatening because it can damage the organs. /r/n/r/n You can be dehydrated in the following ways. /r/n/r/n If you are severely dehydrated, you may experience hand cramps when your muscles lose the proper balance of electrolytes and fluids. /r/n/r/n Additional symptoms of dehydration include /r/n/r/n Writer's cramp, an overuse injury of the hand, affects the muscles used in fine motor movements. It is a type of focal dystonia that affects a single body part, usually the fingers or handsand, causes involuntary or unusual movements. /r/n/r/n Certain activities can lead to writer's cramp, including /r/n/r/n Carpal tunnel syndrome. CTS, occurs when the nerve that goes from the forearm to the palm is compressed. People with CTS may experience hand cramps. /r/n/r/n Additional symptoms of CTS include /r/n/r/nRA is an inflammatory disease in which the immune system malfunctions and attacks the tissue protecting the joints and in other body areas. It causes joint pain, swelling, and stiffness. Hand cramps are common in people with RA. /r/n/r/n Inflammation, swelling, of the joints and tendons can affect nearby muscles and muscle function in people with RA, leading to muscle cramps. Because RA can affect the small joints of the hands and fingers, cramping here is not unusual. /r/n/r/n Hand cramping in RA can get worse under certain conditions, such as cold weather, periods of increased joint inflammation, and repetitive motions, such as typing and writing. /r/n/r/n hand cramping is common in people with kidney damage. It is thought to be related to nerve damage, blood circulation problems, or electrolyte and fluid imbalances. It is not unusual for people with kidney disease to experience cramping in their hands and wrists. /r/n/r/n diabetes, a condition that affects how the body regulates blood sugar, can cause muscle cramps throughout the body, including in the hands. Hand cramping in diabetes might be linked to low blood sugar, reduced blood flow to the hands, neuropathy, diabetic nerve damage, nephropathy, diabetic kidney damage, and electrolyte imbalance. /r/n/r/n diabetes is also linked to diabetic arthropathy, also known as stiff hand syndrome, which causes hand cramps and thickening of the skin in the hands. /r/n/r/n a number of neurological conditions can cause hand cramps. These conditions affect the nerves that manage muscle functions. Examples include Parkinson's disease, myasthenia gravis, and amyotrophic lateral sclerosis, ALS. /r/n/r/n various medications can cause cramps as a side effect of treatment. These include /r/n/r/n the terms cramp and spasm are often used interchangeably, but they are actually different symptoms. /r/n/r/n muscle cramps are sustained muscle contractions. They can be intense and painful, affecting one muscle or a group of muscles. They occur spontaneously, often with exercise, but they can also occur with rest. /r/n/r/n a muscle spasm is a sudden, involuntary contraction or relaxation of a muscle or muscle group. It occurs when the nerves controlling muscle movement fail, leading to sudden contraction and tightening. /r/n/r/n the symptoms of hand cramps vary in severity, duration, and the condition causing them. Cramping might feel like a slight nuisance, or it can cause excruciating pain. /r/n/r/n some people may also experience numbness, tingling, and burning of the affected hands. Others may have problems with grip and strength. /r/n/r/n additional symptoms that may occur with hand cramps include /r/n/r/n some cases of hand cramps are harmless and easily managed at home. Other causes may present health risks and require medical treatment. /r/n/r/n contact a healthcare provider for new, ongoing, or recurring hand cramp symptoms. You should also seek help for symptoms that do not improve with self-care and over-the-counter, OTC, treatments or that are accompanied by additional symptoms, such as /r/n/r/n mild hand cramp symptoms can be treated at home with self-care. /r/n/r/n self-care remedies for hand cramps include /r/n/r/n you can do things to prevent hand cramping and pain if you do a lot of writing. /r/n/r/n depending on the cause and severity of the hand cramps, your healthcare provider can create a treatment plan to manage your symptoms. /r/n/r/n a flare-up is a worsening of symptoms, and hand cramping can lead to periods of flare-up. /r/n/r/n one of the best things you can do to avoid hand cramps is to not smoke. Smoking is linked to various hand problems, including reduced blood flow, poor wound and bone healing, nerve problems, and pain. If you need help quitting, let a healthcare provider know. /r/n/r/n additional ways to prevent hand cramps are /r/n/r/n hand cramps occur for many reasons, some mild and others considered severe or concerning. Causes may include electrolyte imbalances, nutrient deficiencies, dehydration, injury, or chronic diseases like rheumatoid arthritis, diabetes, or kidney disease. /r/n/r/n treatment options depend on the underlying cause but can include medication, physical therapy, occupational therapy, and surgery. You can manage symptoms at home with self-care remedies like hand exercises, hot and cold therapy, rest, increasing fluids and electrolytes, and massage. /r/n/r/n You can prevent hand cramps by eating a healthy diet, having an ergonomic workspace, resting, stretching, and not smoking. /r/n/r/n Contact your healthcare provider if you experience new or ongoing symptoms, severe pain, or changes in hand function. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.